Welcome back. Well, we continue with this discussion around foreign nationals accessing healthcare. This is after we saw march and various activists in Durban as well as in Rosettenville here in Gauteng marching to healthcare facilities, raising the issue of giving access to healthcare to illegal immigrants. And we get the response now from the Health Department spokesperson, Foster Mohale, who joins us via video link. Mr. Mohale, good evening to you. Again, I need to say that this is such an emotive discussion, and it gets South Africans, you know, quite the reaction from South Africans. But you listen to what Jacinta had to say, and she really is digging in her heels, that the government is failing, that communities know that our health systems are buckling under the pressure, but they need to share these resources and someone needs to take accountability. What do you say to that?
Good evening to you, Naledi, and good evening to your viewers at home, and thanks for this opportunity. Look, there's no doubt that the issue of illegal immigrant is straining the little budget that we have as a country, but unfortunately, the laws of the country we can't change the laws of the country to suit a certain narrative or intentions of groupings or individuals who are against this brothers and sisters from other countries. But also as the Department of Health, we have noted all the marches and the protests by different organizations and groups who visit our health facilities, especially in Gauteng and KZN, preventing the healthcare users, demanding to see their form of identity before they can allow them, which is against the law, which is illegal. But secondly, as the department also, we condemn the actions by those who come into our country illegally for the sole purpose of accessing our healthcare facility, especially in public facility, as you know that the majority of citizens, they rely on the public health facilities.
I want to get into this interpretation of the law, because it's certainly the Constitution, because Jacinta and I, you know, disagreeing, I suppose, on what we're both putting forward. And I mentioned Section 27 of the Constitution. Everyone has the right to access to healthcare services, including reproductive healthcare. This is according to the South African human rights. It then says the provision includes refugees and asylum seekers, documented and undocumented migrants, and stateless persons. Now, she argues that no, the Constitution says access to everyone, but it should not include undocumented migrants. What do you say to that?
Yeah, look, apart from the supreme law of the country, which is the Constitution, and in fact, it says the provision of healthcare to all individuals in the country, regardless of their immigration status. But also, there's another piece of legislation called the Refugee Act, which says everyone, including the refugees and asylum seekers, have got the right to access health services, and also no one can prohibit them. Then there's another piece of legislation called Immigration Act, which says while the health facilities are permitted to inquire about the legal status, they should not hinder the provision of health service. So we say, look, we understand the concerns by those who argue that there are a lot of illegal immigrants in the country who are accessing our health facilities, but we say they need to do the right thing. The right thing is to say, if you know, Naledi, that Foster and anyone around your area is illegally in the country, the best thing that you can do is to notify the law enforcement agencies or immigration officers of either Border Management Authority under the leadership of Dr. Michael Masiapato, or the SAPS to arrest those and deport them instead of taking the law into your own hands. You cannot try to correct crime with the criminal activities. Of course, anyone who's in the country illegally, they committed a crime, but you can't correct a crime with another illegal activity. So you'll end up being in jail and will deport the one that you're against, then you'll also be in jail. But secondly, this happens at the time when we are likely to experience the emergence of a new COVID-19 variant and the outbreak of other infectious diseases like measles. So you never know among the healthcare users who is the carrier of these infectious diseases. And this will defeat the efforts of a government to prevent further spread of infectious diseases.
Okay. Just lastly, though, I mean, at some point, though, we do need to have the discussion around the pressure that is being put on our healthcare facilities. We at this point may not even have a full grasp on just how many illegal foreign nationals we have in a certain community that are putting pressure on our healthcare facilities. The argument being put on the table, though, surely an important one.
Yeah, no, definitely there's no argument that a number of health facilities, especially facilities from provinces or districts which are bordering with the neighboring countries, like, for example, Musina, which is bordering with Zimbabwe, and Mangusi, which bordering with Mozambique on the KZN part, and other parts of Mpumalanga, which bordering with Swaziland and Mozambique. So those facilities, and Lesotho and Western Free State. So those facilities, of course, they experience a lot of foreign nationals who come to the country to access the healthcare service. But look, we condemn that, but we say let's follow the right channels. So let's raise our concerns through the illegal means instead of taking the law into our own hands, because here we've got the supreme law of the country, which is the constitution, supported by other pieces of legislation with regards to access to healthcare service in the country. Yes, we understand the concerns, but we say let's raise this issue. I know one of the organizations also is proposing the amendment of the law. Look, it's one of the most progressive proposal in order to address some of these issues. So, and we welcome that.
Okay. So that being a discussion for the future, amendments, legislative amendments. We're gonna leave it there. But thank you so much for speaking to us. Of course, Mr. Foster Mohale is the spokesperson for the Department of Health. We've got some WhatsApps from our viewers on this discussion as well. Let's put those up on the screen and see what some of our viewers have had to say on this one. Pregi Naidu says the foreigner are overrunning the hospital. The South African Health Department has a budget for South African citizens. Our South Africans must have first preference in getting health services. Pregi, thank you so much for that. Skalo says, I agree wholeheartedly with Jacinta. My work allows me to travel to most African countries and they will not let you into their country without medical insurance. South Africans first. Skalo sends that message. Thank you so much. Max in Johannesburg says, good evening, lady. I think for someone to be illegal, it's because of the government failing to document them. So what we are doing today to our fellow Africans must come back to us in future because God is watching. Thank you. Max, appreciate it. And Lawrence Banda says, good evening, lady. We all have the right to life. Lawrence, thank you so much for your contributions as well. You're still watching Newsfeed PM, the late edition. Got your headlines at the top of the hour. Stay with us.